Did you know 80% of the general population takes at least one supplement a day? Why are they doing that? Good question. Was that because somebody told them to do it, because a doctor recommended it, or because somebody was trying to sell them something? Good question. I'm Dr. Ron Rigby. I'm a board-certified family physician, and I'm also a diplomat of the American Board of Obesity Medicine, trying to help people feel better, to optimize their health, be it lose weight or optimize their hormones. So why are so many people taking supplements? And are they taking the right type? And which ones should you take? Now, there's a long list of things you could take, maybe should take. Good question. We're going to start with 3 key ones. And again, one being you should take it because your levels, or you need it to feel better, not just because it's something to take. The first one would be vitamin D. Especially if you live where it's cold during the winter, you're not out in the sun, vitamin D is a key factor that can help ramp up your immune system, help with your energy level, but also helps us with good quality bone health. So if your level's low, even within the normal limits when you go see your doctor, if it's less than 60, in my opinion, you should probably take some. Keep in mind it's a fat-soluble vitamin. Because of that, you need healthier fat in your diet to actually absorb it. But we also need the sun exposure, preferably early in the morning. Go out, get some sun, even if it's cold. Go out in short sleeve so you can get some of that exposure for a short period of time. The second one I'd recommend, or second group that you could take, was a good multivitamin. Keyword there is good. There's lots of different multivitamins out there. You have to be careful with some of the bigger brand ones because they're hard packed and they have some sugar in it. So just be careful with that. But the reason I recommend that is because unless you're using or eating a wide variety of foods with a wide variety of nutrients, you're probably not getting a lot. And unfortunately, if we're getting most of it from places that are monocropping, meaning they grow the same thing over and over and over, some of the nutrients are gradually going down. So adding a multivitamin could be very beneficial to help. Third, this one might be a little different for most people, some melatonin. Melatonin is an actual hormone in our body and it can help you sleep better, but it's not just taking it right before bed. We need to take it a couple hours before bed, but we need to take it no matter what in the evening. Might help us with sleep, and sleep's a key factor to help with your hormone optimization, but also for energy, but also helps with weight loss. And again, that's one aspect I'm trying to focus on, trying to help improvement with. So my 3 call to actions would be consider supplements, but also consider where you're getting it and why are you taking it. If you feel like you need it, great. If you're not sure, ask. Unfortunately, doctors don't always get taught on those things, but at least ask because it can interact with some of the other medicines you're taking. So always ask on that one. 2, not all supplements the same. Quality is a key factor. Who's determining that? The bad thing is there's no governing body. I'm not saying that's a good thing, but just because they claim it doesn't mean it always will be. And let's focus on your metabolic health, and that's where vitamin D, multivitamin, and melatonin come into play. Let's get you feeling optimal.